Hey everyone, I'll be going over pet therapy and healthcare and why animal assisted therapy is a great method of um, care for patients. So imagine being in a hospital bed. You feel anxious, lonely, and unsure about your recovery. Then, out of nowhere, a dog walks in with its handler. And within moments, you're smiling, your blood pressure drops, and for a short time, you actually start to feel better. This just shows how powerful pet therapy can be. And it doesn't just treat illness, it actually helps heal the human spirit and can make somebody feel a lot better. Now, here's the science behind it. Pet therapy lowers stress hormones like cortisol while increasing bonding hormones like oxytocin. It improves cardiovascular health markers like blood pressure and a person's heart rate. But what's more important is patients tend to show less depression and anxiety and more positive social interactions due to pet therapy. And these results that can be measured are why pet therapy matters because it treats both a person's mind and body, which is extremely important. And to me, this is the logos part of it. Although some people argue that pet therapy brings risks like an infection or it could even disrupt routines, I believe pet therapy should be expanded in healthcare because it reduces anxiety, it improves a person's motivation, and it increases their overall satisfaction. And I base this on credible studies that I will share with you today later on in this presentation. So my argument first would be that pet therapy helps with conditions like depression, PTSD, and even schizophrenia. According to Arsovsky 2024, patients who participated in animal-assisted therapy showed lower cortisol, higher oxytocin, and reduced stress. This even improved the mood and the quality of life for the patient. And by citing this peer-reviewed study, I'm showing you that my argument rests on scientific evidence and not just my personal opinion. And this has to do with my logos and my ethos. Now, my second argument would be these results are consistent across many studies, which shows my logos because Panday and colleagues 2024, according to Panday and colleagues in 2024, they reviewed 16 studies from 2015 to 2023. And they found that pet therapy consistently lowered stress and anxiety and improved the mental health outcomes, which is my ethos. Multiple studies agreeing over almost a decade gives my position, which I believe that pet therapy is great for healthcare credibility. And this shows that pet therapy isn't just something that is considered a trend. It's actually proven because of these studies to be a form of care for the patients. Now for from other standpoints, which people object would be that some people would object that pet therapy could animals of pet therapy could spread germs or even bacteria, trigger allergies. But according to Dalton 2020, he raised concerns about inconsistent infection control rules across hospitals. Now, using my ethos, I want to show that I've studied both sides of this argument. And my response would be that these issues can be managed with, animal screenings, hand hygiene, washing your hands, areas that are designated for therapy zones, and using the One Health approach. This evidence shows risks are real but manageable, and the benefits are far outweigh them. Now, let's step back for a moment. Use my pathos, I could, just think about yourself or someone you love in a hospital. Medicine treats the illness, but comfort, connection, and motivation also matters. I personally seen patients, days get a lot better when a therapy dog walks into the room. Their stress just seems to go away, and their determination continues to recovery just continues to grow. The emotional impact is something no pill can replace, and this is why we need to value therapies that touch the heart as well as the body. The conclusion and call to action would be that pet therapy lowers stress and anxiety. They improve the mood, motivates recovery, and strengthens social bonds. Multiple studies back this up, and even critics admit that risks can be handled safely with proper protocols. So my call to action is simple. Healthcare facilities should expand pet therapy programs while practicing safe infection control guidelines. But by doing this, we can shorten hospital stays, increase patient satisfaction, and bring healing that goes beyond medicine. So the next time you think about your healthcare, just remember that sometimes the best medicine might just be a dog or another form of pet therapy. Because come on, if you see a wagging tail, you know you know it's gonna be a good day. Thanks everybody. I appreciate your time. Have a great day.